Look, councillors, thank you for attending today's ordinary council. Thursday, the 27th of May, 2021. Ask Paul if he could do the opening karakia. Thanks, Paul.
Timotanga me te whakamutunga o ngā mea katoa, I rena hei whakawhitua tāta ki tō tātou kai anō. Tō mātou mātou I te rangi, whakapangi I mātou I tō mātou hui, hina mai a tātou kōrero ki te huarahi tika I tēnei hui ana.
Amen. It has been suggested that other councillors may like to consider opening doing the karakia at council meetings, and if you'd like to, if you'd be able to assist, let me know. It's something that should be shared around. It's on the advice of a friend here. Right, we'll move on to item 2 of the agenda, which are the apologies. Now I have an apology for lateness from Councillor Cogan. Apology for lateness from Councillor Kennedy, apology for lateness from Councillor Martin, and from Francois. Are there any other apologies? So I'd like to move that the apologies be accepted. Councillor Neal, thank you. Councillor Hart, those in favour?
Aye.
Thank you. The item 3 on the agenda is the conflict of interests. If there is anything on today's agenda that you feel possibly, could be, maybe raises a conflict, please update it. It is on team systems, but I will pass it around. Move on to item 4 on the agenda. Are there any urgent items not on the agenda? Thank you. Move on to item 5 on the agenda, and it's the minutes of the ordinary council meeting on the 29th of April 2021. They've been separately circulated on team systems. There's been no requests for changes. Are there any changes that anyone would like to bring up? Could I get Councillor to move that the minutes of the ordinary council meeting held on the 29th of April 2021 be confirmed as a true and correct record of the meeting? So Deputy Mayor Carruthers, do I have a second? Councillor Neal, thank you. Those in favour?
Aye.
The minutes for the Extraordinary Chief Executives Review Committee meeting, which was also on the 29th of April. These minutes have been circulated and they're to be received at this meeting. Would someone like to move that the minutes of the Extraordinary Chief Executives Review Committee meeting held on the 29th of April 2021 be received? So, Deputy Mayor Carruthers, Councillor Neal, thank you. Those in favour? We move on to the Extraordinary Council meeting minutes of the 7th of May. Once again, the minutes have been circulated. Are there any matters or any changes that our councillors seek? I ask that a councillor move that the minutes of the Extraordinary Council meeting held on the 7th of May 2021 be confirmed as a true and correct record of the meeting. Councillor Hart, thank you. Councillor Davidson, those in favour?
Aye.
I approve that my digital signature be added to the confirmed meeting minutes of the Ordinary Council meeting held on the 29th of April and the Extraordinary Council meeting held on the 7th of May 2021. Move on to action 6 on the agenda, and it's the action list, and it's set out on pages 6 to 8 of your agenda. Chief Executive will present.
Yeah, good afternoon, Your Worship and councillors. I'll take you through point by point the action list. The first action point is this Canary School crossing. Unfortunately, this is a well overdue action, as you can see highlighted in red. We still have a couple of months of work to do to get this completed. This has to go out and get tendered because of the pricing. Goes over our procurement policy, so we'll be processing that over the next few weeks. Fox landfill, you'll see today in today's confidential meeting that Butler's landfill tender has been completed. A selection tender has been nominated. Just to reinforce the work, the Fox landfill itself has been completed at the Fox River, and remediation work is completed as well, and the cleanup work has also been completed quite very successfully. Iwi representation around council table. This is obviously a workshop being progressed through Councillor Martin and Councillor Hart being involved as well. Hokitika wastewater treatment plant. A new concept discussion today also with council regards the oversight committee or subcommittee for that project to be processed, and then obviously a workshop following straight after that with our project manager Stan to kick that off. Committee and subcommittee meeting structure has been completed, last council meeting. Speed limit register review stage 2 on hold, rating the outcome of NCTA speed limits review. Ross Chinese Gardens flooding issues. So we have an agreed concept in terms of mitigating the lake. There's an on-site meeting happening in the week starting the 7th of June with Doc and ourselves, and design will then go through to a resource consent process. It does take some time. It's not something that will be done tomorrow. So once the design is completed, then that'll get processed through regional council for approval. We also have to obviously ensure that the landowner agrees with that design. So working through that. Just a second point there regarding master plan. I believe Councillor Cogan is meeting with the Rennis group next week. We have had a meeting with both Rennis and the community group last week to find a way forward. We have basically put a line in the sand in terms of the way forward. Councillor Cogan will be leading it on behalf of council along with council staff as required. Enviro Schools letter that's been completed to regional council. This action may have to come back up again next. Mark Davies was meant to be speaking today, Your Worship. It's not available, so we'll reschedule him for a later date. Workshop with holdings, Western Holding directors. Plan to do it as part of the pre-work with the SOI and the governance structure in June. Kamara Gardens, we've been in touch with the community group there and requested that they apply to council for the funding to request release of some of the funds in the Kamara Endowment Fund, and they're waiting for them to write to council to do that. And Jobs for Nature, there was also meant to be presented today to the council, and we may have to reschedule that as well. Happy to take any questions.
Councillors, matters under action. Perhaps Paul.
My question is just to comment that the traffic light system is working very well.
Councillor Hart.
No questions from me, thanks.
Councillor Hartshaw.
No questions, thank you.
Councillor Hill.
No, all good, thank you.
Councillor Davidson.
Thanks, right there.
Oh,
Thanks.
we don't get that very often.
Thank you very much.
Could I, council, to move that the action list be received and that we remove from the action list the committee, subcommittee meeting structure, the Enviro Schools letter, and would we remove the two Mark Davies?
We'll leave them on there and provide a future date for council.
So we'll reschedule future day. Someone like to move in that direction? Councillor Hart, thank you. Councillor Davidson, those in favour?
Aye.
Next item on the agenda. And it's a great pleasure to introduce David Smith. And we're leaving over to Mark Davies' presentation because he's otherwise engaged. Perhaps you could introduce yourself and just there are people watching on live stream. I'm sure they'll be very interested in what you're about to see.
Kia koutou, ko David Smith aho. I have a day job as a locality manager for the southern locality of the West Coast DHB. That is our services from Hokitika through to Haas. I've been moonlighting for the last 3 months or so, helping lead the COVID vaccination rollout across the West Coast. So thank you for the opportunity to present to councillors and indeed officers today and anyone watching. What I intend to do is just give a very brief description of our strategy, our process, where we're up to, how we're doing and what comes next. And I'm more than happy to field questions as we go or at the end. Someone please watch my time, because otherwise I'll keep talking. So someone will need to stop me. The way I've described this in the past is we had a COVID outbreak, there's been a pandemic, we kind of all know that, they've invented a vaccine and now we've got to get it to our community. The way we protect our community is through the COVID Tracer app, through good border protection, and the vaccination program is how we will then bold embraces that process and create that protection for our community, for our societies, and in particular for vulnerable people. How do we get that out there? So the Ministry of Health developed a rollout sequencing framework, and they said we'll start with border workers, with MIQ workers, then we'll move to frontline health workers and other health workers and those in emergency services, and then we'll look at those vulnerable populations. We'll look at people in aged residential care facilities and other residential care facilities. We'll look at people with underlying health conditions. We'll look at people who are over 65. There's a close focus for Māori throughout the process, and ultimately we will reach group 4, which is the general public. The West Coast DHB, we were charged with developing a plan to address that in our community, and that sequencing framework is certainly a very powerful guide for us. We are nevertheless a far-flung rural community, and when it comes to offering vaccinations to the first group, we actually didn't have many. So, although at one stage the ministry did seem to think we had an international airport and port here, we've had a look and we don't. And so in the first group of border workers and MIQ, there was no work essentially for us. When we started our vaccination campaign looking at the health workforce, there were a few household contacts of people who do work in MIQ facilities in various places around the country, and they were mopped up within the first few days. The trick for us is that we can't just focus on the one group. We found indeed initially, when we tried initially to focus very much on that group 2, health workforce, frontline healthcare, primary care, we were very quickly running out of people on any given day because there just aren't that many people on the West Coast in any of those groups. The ministry accept that. They understand, like some other areas of New Zealand, although we're probably one of the most rural, but they do accept that in more rural communities there has to be a degree more flexibility. So we've been reaching forward across the groups and using that flexibility. So our basic game plan, our basic strategy has been to say we need to start off and prove to ourselves we can do it. So we established a static vaccination clinic in Greymouth at the Taniko facility there, and we got cracking. And we drew staff in from all sorts of places, we wrote people in, and we've proven a model that we know can work and we can deliver these vaccinations. We've since established a second static site in Westport. The balance of our community, roughly we think about half of the community of eligible people who will receive a vaccination will be delivered by our mobile process by our mobile teams. We've got a van and we've got a bunch of stuff in the van, and our teams will be travelling to locations. Now, we've tested that methodology by going around our aged residential care facilities. So already now we're reaching into group 3, and we've started to go around our aged residential care facilities, and indeed all the aged residential care facilities on the coast so far, other than Kapiti, which is on site, have had a first visit, and we've done first doses. Again, because on the West Coast, we have to be a little more practical than perhaps they need to be in other places. For example, when we went to Reefton 2 Thursdays ago, there were only a handful of rest home residents who to vaccinate, but we took 180 doses of vaccine. And on that first visit, we were able to do those residents, and we dealt with them because they were our actual reason for going. So we respectfully managed their vaccination issues. We addressed the rest home staff, we addressed the staff in the primary care facility, we addressed all the other health workers in Reefton. We looked at family members who regularly visit the aged residential care facility. We looked at emergency services, fire, police, AMBO, and we then reached forward to people with underlying conditions, and we ended up delivering 180 vaccines. So our strategy here on the coast is to reflect and respect the ministry sequencing framework, while at the same time adopting a pragmatic, common sense approach to getting these vaccines out to our community. There's 2 other key elements to the strategy. The first is what we've referred to, and unfortunately every other DHB in the country has a version of a farm-out strategy. Our intention right from the start with the involvement of our iwi partners and our Putini Waiora service partners during our initial scoping of how we would do this, we decided we needed to do slightly more than just lip service. So our whānau strategy was to say that when a person identifying as Māori or Pacific presented for vaccination, we would then welcome their household members for vaccination. The theory there being that if you want to create equity, you have to engineer equity in from the beginning. So by making that invitation and wrapping protection around an entire household, the theory being that if there is an outbreak of COVID, we know statistically and from all the evidence that will impact Māori households greater than other households. So by wrapping protection around Māori households, the theory was we would be creating an additional layer of protection and just tipping the scales of equity back that tiny little bit. And we felt that was worth doing. Subsequently, I'll add a little footnote there, which is that we are now offering vaccination to all Māori and all Pacific Island, because of the way our approach, it's the numbers game thing, and so that is now available to all Māori on the West Coast. They just need to come to us to make an appointment, but we will also work with Putini Waiora as we roll it out and look at how and where we may be able to support a more targeted approach in that respect. The second aspect of our strategy on the coast that is perhaps different to some of the larger urban areas is that in the urban areas, they're able to contract with other providers. So DHBs have contracted with collectives of pharmacy providers or a collective of pharmacy plus GP, and they're busy doing this program. They're managing the entire program. On the West Coast, there is not the scale. There are no providers who are keen to step forward and say, we will subcontract this, give it to us, we'll take it. So it kind of falls to the DHB to do it. So what we have tried very hard to create is a partnership with all the other health providers on the coast, with general practice, with community pharmacy, with Putini Waiora, so that we are working in partnership to utilise members of their teams as they are able to support the process, so that people in locations or areas have familiar faces as part of the team delivering the service. And to, I guess what we're hoping to do out of one of the goals of this project that we've got on the way through, although we're working very much on a day-to-day basis, we do have a concept that we may actually leave some legacies going forward of stronger partnerships with communities, stronger partnership with iwi, and stronger partnership with our health provider partners. So, I mean, essentially that's what we're up and we're doing. So where are we up to? We have, we're delivering approximately 1,200 vaccinations a week at the moment, building from 30 in our first week, where we started nice and small and made sure we could do it, and we built to 60 to 90 to 120. Westport's come online, and we're now delivering approximately 1,200 vaccinations a week. That number will continue to climb through to 1,500, 1,600, 2,000. At around 2,000 vaccinations a week, we mathematically will be able to complete the West Coast community by Christmas, which is the ministry's target. One of the important things in our speed is that on a given day we might be able to go do more, but we can't get too far ahead. We just certainly don't want to get behind our projection plan, because that will go down unfavourably. But equally, we can't afford to get too far ahead, because if we get too far ahead, someone else is going to end up getting behind. So there's an obligation to maintain a bit of national consistency. So currently we're sitting very close to 100% of where we thought we'd be. Some DHBs are at 160%, and I don't know that they're very popular, and some are at 75%, and I don't know that they're very popular. But we're just around 100, and that's kind of where we want to be. We want to just stick to anything. We have completed approximately, or just under 4,000 vaccinations so far, and most of those, certainly more than 3/4, are first vaccinations. Of course, after the 21 days, people are starting to come back for their second vaccination. So just by way of numbers, there are about 26,500 people on the West Coast in the eligible group, that's 16 and over, which is 53,000 vaccinations. We're at, as I say, just under 4,000. So we've got a wee way to go, but I'm very confident we'll get there. There's one other number that I'm really proud of, but what I do want to acknowledge is the team of people that are behind this. People have come together out of day jobs, they've come together from all over the place. And I guess we've done two things in particular. We've adopted the national strategy, and we're trying very hard to follow what the ministry is saying. We're doing what we're told, because we don't want to be creative and different. The other thing we're doing is we're stitching together all of the stuff that health services do on a daily basis. The vaccination component of this is actually really straightforward. Vaccinators have been doing this for years. They do thousands, and they're very good at it. It's all the stuff that goes around it. It's the logistics, it's the cold chain requirements, the ordering mechanisms, the security that has to be in place. So there's an awful lot of stuff that sits around our process that creates the logistic nightmare that this is. But what we've done by using the building blocks of our infection prevention and control team, the expertise of our vaccinator team, and all of those other chunks of expertise, it's then just a matter of stitching that together. And so the quality and the safety and the risk mitigations are all part of using those core elements. I want to emphasise and re-emphasise the extent to which staff have just done an amazing job. The team have done a brilliant job of creating something out of nothing that 3.5 months ago we didn't know what it would look like. There is an analogy that people trot out a lot. We're building the boat while we're sailing it. We're building the boat while the plane while we're flying it. My version of that analogy is we're writing the book. We kind of know how this story finishes, with 80% of the population protected, with the vaccinations all done. But it's very much an exercise in writing the next chapter while we're currently delivering this chapter. And that may sound like an unusual and a non-professional kind of almost way to do it. It is our reality, and I have to say the team are doing a fabulous job of writing the story. The last connection to this presentation today to this group is that when we roll out to group 4, the general public, that's an exercise in us offering to communities. And it's we need to work with those communities to be there on days that work and at times that work, and have access for people that works. We can do our bit, and we want to support and encourage, and so our people who are out in those community areas are supporting us in our planning to make sure that we are as accessible and as available as it can be to the community, so that this is not us coming and telling people what to do or making them fit in with us. This is about us going to those communities in response to the need. So that partnership extends through. Look, I could talk for quite some time. I've got a lot more numbers I could put, and I can give you descriptions of all sorts of things, but I hope that gives a kind of a big picture building block sense of what we're doing and how it's going to continue to roll forward. But I'm really open to questions.
Thanks, David. Councillor Davidson.
Yeah, thanks, David. When you say the offering to the vaccine to all Maori, isn't everyone been offered the vaccine?
Everyone's being offered the vaccine, but it's the sequencing framework. So
Alright.
what we're doing is we're accelerating that access for Māori as part of our targeted strategy to foster and create equity. Certainly, by Christmas, it's our objective that everyone on the West Coast will have had the opportunity, the numerical opportunity to have a vaccine. Certainly, absolutely. If we could reach 100%, I'd be amazed.
Yeah. And that's, the target is to complete by Christmas, and that's the 2 lots of
2 doses.
okay,
Yeah.
that's fine. And I certainly, like your process rather than flying the plane while it's being built. Thank you.
Yeah, Councillor Curry.
Yeah, thanks, David. Great. Sorry, I missed the start of that, but I did get the gist of it. It's pretty incredible when you start talking about numbers of 53,000, to have completed by Christmas time. So, and just for clarification on that, so because I know, you get the 2 injections,
Yes.
but then once you've got them, isn't it then that you come back in 6 months' time and then you get another one and then that lasts for 12 months?
I'm not aware of a specific instruction to come back for a 3rd dose.
Right.
All I know formally so far is that there are the first 2 doses 21 days apart.
Yeah.
I think there certainly will be a question as to what happens next, and much like seasonal flu, where each year there's a variation created and we get a seasonal flu vaccination. Potentially that could be our reality. At this stage, we've got a target of our first 2 at 53,000 by Christmas.
Yeah.
I'm sure over time there'll be greater clarity on what comes next.
Well, well done to you guys, and the team you've got on board for what you're rolling out.
Councillor Neal.
Yeah, thank you. I think you pretty much answered some of the questions that I had. We've heard a few comments about, we've been offered it because they had more vaccines, but you've explained that why, and great to see it being fully utilised. Yeah. What sort of percentages with the groups that you've done so far are saying no to the offer?
So I can't tell you the answer to that question because the people we're seeing are the people who are saying yes. The people who are ringing up and making appointments or who are in these target groups and are coming for vaccination are all people saying yes. The people who are saying no currently, the people who have made a choice or are still deciding, are simply not presenting, so we're not seeing them. And it won't be until we start to get to the further down the track where we're going, we've been to XYZ place 3 times or to XYZ community 3 times, no one else is putting their hand up, but we're pretty sure there's a few more people here. That's when we'll start to understand who's choosing not to. At this stage, as we open the gates to make it available, we're dealing with the first half of the bell-shaped curve, the people who are really keen, and it won't be until later that we see who's on that side.
Yeah, thank you. So can you use health client lists?
Oh, absolutely. So when it comes,
you can go through them and
when it comes to group 3, which is people with underlying health conditions, that is absolutely a partnership with primary practice, where those primary practices have the list of their vulnerable populations. They know who they are supporting with ongoing chronic health conditions or other disabilities or various issues. So they know who they are and they will be inviting those people. So Western Medical will be putting that invitation out to their enrolled patients who have those underlying health conditions, and ditto all the other primary care services. So they will invite their patients, and so we're constantly minded of our obligations around privacy. But they are their patients, and it is their job to do that, and they're really keen to do it. And so those people will know that they're being invited. They will get those messages, whether by text or email or by phone call. Ultimately, we'll get to the general public, and at that point, it becomes more of a general public information invitation, through media and through other sources. That's chapter 8. We'll get to that.
Thank you very much.
Oh, you're welcome.
Yeah, good to know.
Councillor Hartwell.
Yeah, g'day. The rollout doesn't happen on the weekends. It's just 5 days a week, is it?
We are operating in both Greymouth and Westport Tuesday through to Saturday. So we have a Saturday clinic in both places. And certainly in Greymouth already we have an evening process. So our Wednesdays in Greymouth run from 2 to 8 or thereabouts until we've done all the vaccines we have for that day. The reason for the Tuesday through Saturday is that the vaccines start in Auckland at minus 90 degrees and then they start their journey defrosting through to us. So we get deliveries from Monday to Friday, which means we can then use those from Tuesday through to Saturday. I just mentioned that other number that I remembered I was going to tell you about. The ministry are really focused on us not wasting a single dose. That every time we draw up a vial into the 6 syringes, we're required to give them. If we end up, we've got 6 hours from the time they're drawn up to use them. Otherwise, they have to go down the sink. And so far, on just under 4,000 vaccinations, we've wasted none. And I can tell you that there's been a couple of days where we've had a few left and we've had to ring around to find people. And we have worked from a prioritised standby list. And every now and again, we've gone quite a long way through that list before we can find people who are available to come in at short notice. But again, that's a tribute to the team's dedication and commitment and frantic activity that so far we've wasted none. I'm sure it'll happen, but so far so good. And that's very cool.
Well done.
So, yeah, so you got calculations about 380 people a day till the end of the year. Does that sound normal? Sound right?
Yeah, to get there, once we hit our final full speed of public plus our mobiles going each week, we'll be at about just over 2,000 a week. So 5 days, 5 into 2,000, yeah, 300 to 400. And but yeah, it's plenty.
Yeah, thank you.
Sorry, Councillor Kennedy.
Oh yeah, sorry, for my lateness there. Just a question about how the rollout's going to happen in South Westland and how you're going to, deal with that in all these communities, given the access to a doctor currently in South Westland's marginal at best.
So our mobile process, I think, as I say, roughly half of our West Coast community will be getting their vaccination via some sort of mobile clinic. We're currently scoping out the locations where we can effectively set up a clinic in a way that meets the Ministry of Health's requirements for observation space and space for registration and privacy and so forth. The essential strategy has been to start at the largest location and we'll keep working our way through. We chose to pilot our mobiles in the aged residential care facilities because it gave us a little bit more, certainty of what we were dealing with. We're scoping Karamea as a location. We're scoping locations in Haast, locations in Franz Joseph. We will work through and get to the smallest possible size community that's pragmatic. The other issue there is that the ministry's constraints on what we can and can't do are continuing to evolve as more is understood, as there's greater learning. So we had originally come up with the idea, wouldn't it be wonderful if we could get the van and the team, set up it for an hour in Ross in the morning, do 35 to 40 vaccines in Ross for people who are booked in Ross, and then shoot on down to Harry, do 60 vaccines there between 11 and 2, and then do a bunch in Whakaroa late afternoon, camp up in Franz for the night, and then do a big day in Franz and Fox. Then came a sense from the ministry that kind of transporting the vaccines was a bit of a no-no to begin with, but we're starting to get a sense that there's a lot more, that there is more flexibility with how we can do that. So we're still writing that piece of the plan, but we're scoping out venues all the way up and down the coast. And I guess that's where it will become a partnership with the community, because this vaccine, unlike the flu vaccine, which is a lot more flexible in how it can be delivered, we're not going to be able to park up at a set of mailboxes where there's 6 houses in the back of the vehicle and do 6 vaccinations in people's cars or at their mailbox. So there's a sort of a bit of a trade-off between how granular we can be in getting to our communities while still meeting the quite rigid requirements of the ministry about what we can deliver. We will continue to work with those communities. My sense is that when we've done Fox, Franz, Karamea, Reefton, Haast, we will then be saying, how do we get to Ross, which of course is much smaller? What's our process there? Now, a lot of Ross people will have come to Hope Ticker clinics by then. But we know that there is, as we get further and further towards the end of the year, we're going to have to be more and more creative.
Cool, thank you for that.
No, you're welcome.
Councillor Hart.
Thanks, David. There was talk about securing enough vaccines. Has that been, we have secured enough vaccines to cover these 53,000 vaccinations that we need to cover the coast?
That's my understanding. Luckily, that's not my challenge. The ministry obviously know how many people we've got on the coast here, and we've confirmed how many vaccines we need to do our eligible population. We put in our orders every few days. We put orders through, and they've all arrived so far. I'm sure that our obligation to stay close to what we've projected is because in the big warehouse in Auckland, I'm sure it's a logistical nightmare to work out what goes where and have we, is it all there? I'm confident that it's all been ordered, and I'm confident that it's arriving because certainly we keep getting what we need.
Great, thank you.
Thank you. I'm on the board of Potini Waiora, and we're very happy to be active participants in this. We've got a good team behind us as well. So like Councillor Neil, I'm just wondering about how you treat or how you're going to handle the anti-vaxxers and Gloria Vale, for instance.
So we've got a liaison person who liaises specifically with Gloria Vale, and they are working that through. So I don't have anything I can add particularly there at the moment. I guess our job is to make it available and is to remove as many barriers as we possibly can. And again, I guess this is what we're hoping, is that the community generally will draw us and want us to be there and help with that. We're required to have security present the entire time we have vaccine in the building that's not already in a person's arm. And I think that's part of a ministry expectation of being cautious around what can go on. I think it's about, for me, it's about people going to good, reliable sources of information and creating that understanding. Again, this is a personal observation, but I struggle with the idea of telling people what not to think. I don't think that's an effective strategy. I think you have to encourage people what to think. And I think so what we have to do is put out there plenty of good information, plenty of role modelling. The framework we're working to is that the way to protect our community, the way to protect our country's economy, the way to protect our ability to go for holiday and wherever we might be choosing to go for holiday is to use the COVID app and to get the vaccination to create that resilience for our community. And that's the message that we need to, the ministry are doing an awful lot to try and foster this message. And I think for me, that's what we need to be doing, is we need to be making it very available. We need to be able to answer questions. We've had people turn up for a vaccination and it can take as little as 2 minutes to run through the quick questions, make sure everything's tickety-boo and do the vaccination, and then they move on for their period of observation. But we've had people take half an hour with a vaccinator. And trust me, when you're trying to do 132 vaccinations in one day, that's a heck of a commitment to spend with a person working through their any reservations they have. Clearly, if they've addressed that beforehand, that's good. But if they've still got those reservations, we'll do what we can to explain the science, the evidence, and help people get a good understanding, a sound understanding based in the. I know that doesn't quite answer the question. I think it's a phenomenon that exists, but as I was talking with Councillor Neil before the meeting, we've got to understand that people have these objections and find out what the actual objection is. For some people, it will be some absolute tribal political objection, but for a lot of people, it will be something else that may be caught up in that, but it might be a simple thing to answer if we can actually figure out what they're stuck on. So I think that's.
Yes, unfortunately, in this era of social media, the anti-vaxxers are rather infectious, and, which is unfortunate. But with the misinformation, it has a vehicle. It's unfortunate.
Absolutely. I can say that certainly the ministry and our own communications team are doing, putting together careful information to try and counter that with appropriate messaging, and also through our partners, through the team at Putini, through the other health providers, is when people ask a question, is being able to give good, simple guidance and good, simple information. So that's what we're really working to do.
Thanks, Dave. Good to hear from you. Been wondering how it's all going to work on the West Coast, and it's encouraging to hear it's in such capable hands. How big's your team?
So what we like most areas in New Zealand, we're trying to create a dedicated team, because at the moment a lot of the team have been borrowed from other locations. As I say, I've got a day job, but I'm missing in action currently. So to do a vaccination event, you need security, you need an observer, a reception person to receive people in, and actually we're finding now the numbers are going up, we need 2. You need 3 or 4 vaccinators, you need an additional vaccinator to do the drawing up out of the vials into the syringes, you need a person to undertake the 20 minutes of observation, which sounds easy, and it's actually a very simple task, because most people just sit there and watch the telly or read their phone. But you're constantly checking who's done 20 minutes and who can go. So it's actually a crew. So in Greymouth today, there would be 9 people who are delivering today's clinic, backed up by a team developing the future activities of the program, backed up by a phone answering team, and we still need more. Westport the same, so probably 9 or 10 there, 9 or 10 here. When we go mobile, we had originally thought 2 mobile teams, but it'll actually be a mobile group going to our various locations. So there's another at least 20 people.
These will additional staff be taken off the purposes of the rollout?
Ultimately, they will be. In the meantime, we're drawn on people from our, vaccinators who work in our public health team, vaccinators who work at Putini, vaccinators who work in coastal health. We're drawing on where we can find people who maybe work Monday through Thursday, and then they say, look, I can help you on an observation on Friday. And we part of the message right at the beginning was that we need to do this with as minimal impact on our business as usual healthcare as possible. And we're doing okay with that, but at the moment we're still having to draw on resources. But as we fill those positions, and there are certainly people applying for them, and we're working through and getting them filled, that's actually working really well. And then depending on how this plays forward, what are currently temporary contracts for the duration may become more of an established program.
What I read in the news media, the bulk of the supplies of the Pfizer vaccine won't come into the country till mid to late July, that's what they're saying. But are you saying, answer one question, that there are sufficient stocks on the West Coast available to West Coasters in the meantime, or are you going to ramp up the delivery post the arrival of the stocks in July?
So we only ever stock the next 2 or 3 on the West Coast. We only ever stock the next 2 or 3 days supplies. Currently, they all come through to Greymouth, and then we have to ship the Westport ones up there each morning. And we're ordering as we need. So our chief pharmacist is ordering today. She's ordering for 2 days' time, sort of thing. So we certainly don't hold a warehouse type stock here, but available to us, as far as I'm aware, we've got everything we'll ever need to order. There's certainly been no indication we don't. And as I say, each day it keeps turning up.
Thank you. No, very comprehensive. I get a few calls from people who outside of Hokitika saying, when's it our turn, when's it our turn? What can we do to help you to ensure that these people who are out there in small communities like Okarito, and of course Councillor Kennedy lives there. I mean, how can we help you? When people want to, they keep saying, look, where's ours? What's the best thing we can do?
I think that the assurance that there is a plan forming, we've certainly got the plan of how we're going to get to those communities. We don't have the dates as yet. We're scheduling those. We've got a bit of an idea of some of where the next ones might be. And as we're able to confirm those, we will put those messages out. Bear in mind that technically we're still addressing invited audiences of people with underlying health conditions. As and when we go to the general community and put the big banner up that says, ring us now and book your slot, that's when we will absolutely have some very clearly defined dates, very clearly established locations that have been approved for use, and we will have that program fully in place. Fully in place, he says, with a little asterisk saying, we hope it works, but it will. We're confident it will because we'll get it done.
Look, if we can be of any assistance in ensuring that our residents are aware of the process, especially we're pretty spread out. It's 354 kilometres from here to that.
Completely.
It's a big spread out.
Right, and if you add in Caribbean at the top end of our reach, it's absolutely the case. And look, you make a point there, which is important, that not everyone living here is registered with a medical practice on the West Coast. So actually getting to our entire community is absolutely an agenda where a partnership with the council would be appreciated.
Well, the door's open and we'd love to help you knock over 80% as quick as possible.
Good, thank you.
That's great. Look, thank you very much for the presentation. I hope it's the first of a number. And councillors, I think,
Yeah.
Well done.
Thank you all.
Councillors, could I have someone move that the presentation from David Smith, Manager of Integrated Services, Southern from the West Coast District Health Board, be received? Councillor Neal, thank you. Second to Councillor Hart. All those in favour?
Aye.
Thanks, David. Well done. The next item on the agenda is National Bowel Screening Program.
What a healthy lot we're going to be.
Well, how are we? Mania Cunningham is the project manager for the West Coast District Health Board. Welcome. And the floor is yours.
Kia ora koutou, tēnā koe, te mea, mō tō me, kia ora. Kia ora everyone, my name is Mania Cunningham. I was fortunate enough before Christmas to be employed by the West Coast DHB as a project manager for the bowel screening program. For the last 3 months, my team at the West Coast District Health Board, with support of our partners, received an agreement from the Ministry of Health that the West Coast District Health Board is prepared to roll out the National Bowel Screening Program. So you may have heard yesterday morning and seen in our local papers advertising similar to this. So it's really a monumentous occasion around the bowel screening program. What this, and my role today is one, just to tell councillors what is the bowel screening program, and what it means for the coast and for New Zealand. In the South Island, we are the last region to have this roll out. And that's probably the question why we haven't seen a national advertising. Each region has been advertising and promoting it amongst themselves, but you find by Christmas time, you'll start seeing some national programs on rolling out the bowel screening program. With the North Island, there's 2 more other regions to go, and that means the whole of New Zealand can roll this program out. There's Australia and other countries who have already rolled out this bowel screening program, and some of you may be aware of friends and family in different regions that are already doing it. What the bowel screening is who the bowel screening is targeting is anyone between the ages of 60 to 74. And what will happen is people will first of all get a letter in the mail. The letter in the mail for those participants between 60 and 74 will say they're getting one of these kits. And in the kit is the screening program. Before I open the kit and show you and share just some information. So lung cancer through smoking is the #1 cancer in New Zealand. Second to it is bowel cancer. So we get about 3,000 bowel cancers every year in New Zealand, and from that, about 1,200 people a year die from bowel cancer. Just to keep going on data, Māori are the number one, highest ranking of our treaty partners who get bowel cancer. And so it's just giving an insight on the significance of why it needs to happen. And also, I was talking to our surgeon, Dr. Kevin Naidu, at the hospital here, and he said 35% of people come in with the cancer, it's too late. So, you know, they're at the palliative stage. So that's why these prevention programs, these screening programs are really critical to people's health. Because the reason why this is designed is for people who think they're healthy. I'm healthy, nothing wrong with me. I might have got a sore tummy, nothing wrong with me, that will pass. But by then you realise when you're fit and healthy, between 67, actually there's symptoms of cancer, but we just weren't aware of it. So that's why we want to capture it. If I may, excuse me, this is what it looks like. And here's a barrier. Some people think it's a Harvey Norman advertising, or I think it's a bill, and a lot of people have shown in New Zealand just been putting them away, storing them away, even though they get a letter warning it's coming. And this is why I've also come as I'm asking for support. It's a bit like our COVID vaccine. We're asking for leaders in the community who talk to constituents and say, hey, get it done, do it, open this, do the test. You know, and so that's why David's right. We are looking for partners. We are looking for friends to help us to encourage the community to really take hold of community health and be leaders in promotion.
And where does the mailing list come from? Where do they get the names?
So I actually thought it comes from the polling. I thought it comes, but it actually doesn't. It actually comes from people being registered to a general practice. So people need to be registered for a general practice to receive this kit. So this is the number one message. You can ask people, make sure, because after 3 years, if you've been a doctor for 3 years, you actually fall off their list. And sometimes if you, some general practices will say, please re-enroll or stay with us, but some haven't. And there's actually an average of about 2,000 people on the West Coast that actually are not in this age group who are not registered with the GP. So if you do talk to constituencies and let them know that this is coming, just check, hey, are you registered? This is coming. And one more thing for there are people who won't get this. There are people in that age range who won't get this. And then ones who are already being screened. One's already you've got going through bowel cancer treatment. You can imagine will not get one of these. Excuse me. So I'm just going to open this. Excuse me while I'm banging the table. My plan was to open this before I come. There we go. So fuel. This is the return envelope that you put your sample in. And this is what goes in there. So when you complete your sample, you put this and post it. Now I want to talk about posting on the West Coast because it has to get to Auckland. And it has to be in a lab in Auckland within 8 days. 8 day it has to be in Auckland so the technicians can check it. What they're checking for is blood. They're checking for blood in your poo. So sometimes you might go to the toilet and say, oh, there's no blood there, but because you can't see it, it's that small. And so I'm just going to go through the process again. So we asked people, excuse me for, we are talking about going to the bathroom, but I just really want to make it an education type time now, if I may. We asked people when they do the bowel screening program that they do it at the beginning of the week for postage regions. Number two, they urinate first into the bathroom, flush. They get some toilet paper. They put it at the bottom of the bowl on top of the water, and you have this in your kit. This goes on top of the toilet paper, and the reason is it's to help your poo or your stool just to stay floating for a little bit longer. This is flushable. While it's there, we ask you to stand up, turn around, and do this. And at the very tip, we're asking for no more than a matchstick, even less of a sample. You dip it in, that's it, you put it in, and I can say that's your screening done. That's it. Then we ask you to put it into this envelope and post it. And then we'll go to Auckland, the lab team up there will check if there's any blood in your stool sample. In Auckland, there's what comes next. If it's a negative, in about 3 weeks' time, you'll get a letter from our team in Auckland saying, thank you for doing the bowel screening program, your results are negative. And what will happen is we'll ask you to do this again in 2 years' time. And so we have to normalise screening, as we have to normalise this as part of people's health. If it's positive, the results go back to your GP. Depending where you live and where you are, either your nurse at that GP or your doctor will ring you and say, we've heard back from your bowel screening, it's actually a positive result. Can we talk over the phone, or can you come and see us and tell you what that means? And the first thing the nurse or doctor will say, it doesn't mean you've got cancer. It doesn't. But what it does mean is we need to do a further investigation. And what that further investigation is referring you to the Greymouth Hospital, to Tanika, and doing a colonoscopy. And in the colonoscopy, the surgeon will then, from knowing that there's actually poison, there's blood on your feces, will start looking for those signs of things that aren't right. Something I've learned is called polyps. In your large intestine, you have polyps, and they can be cancerous. Not all of them are. And so what the colonoscopist will do is he'll cut those polyps out, and he'll send it away to Christchurch. The lab in Christchurch, with our partners, our CHB over there, will check if there's any cancer cells in there. But that's the prevention. That's the prevention, because if you don't capture those polyps early, and then that's when cancer will spread. Yeah. But if we can take them out, get rid of those polyps early, that's when we're successful for those people who are positive. And then once they've been through that system, once they've been through that, they will be asked to do the skin in 5 years, not 2 years, but 5, because generally it takes about 5 years for a cancer cell from a polyp to start again. If in Canterbury, it's quite sad, and I'm sorry, but some people have done the bowel screening over here. They're at that palliative stage, they've done the bowel screening and gone through it, but the cancer. But they didn't know, or they were sick and just never went to the doctor. And a lot of cancers have been detected, so the program does work. But it only works if people do this, if we can capture them early. So I am being a bit of a car salesman, I am asking for help. If you are in your community, talking to your constituents, bowel screening, and just checking, hey, have you got this? Yeah, it's on my, it's in the back corner, no, please go get it. Please.
No, what's the return rate like? So if you send out 100, how do you get that?
Yeah, it's a great question. So I can tell you now, all the regions are different. All the regions, I think in Canada right now is about a 60% return rate. South Westland, out of New Zealand's the best, that region. So I'm competing with them, to be honest, down Southland. So with Māori participation, 72% of people Māori in that region, that age, the big subtype is like about 69 to 70% of the population at that time. But other regions are varying, but I can tell you this, the research shows people between 65 and 74 are great. They're really doing it, but so people between 60 and 65, they're not so great. So we're trying to look at, they're trying to do the science, how can we encourage that? One thing I do want to talk about participants, a lot of people say actually 60 is too late. A lot of people get bowel cancer much, much younger. And people are saying it should be 50 up. And so there's 3 regions, North Island, testing that now. So just wanted to be aware of that. I might just pause if you don't mind, have a breather. Sorry. And also just I know this is, but before I ask for any questions, I think humour is really important. I think there's not too many of us where, so when you do have those conversations, if we can encourage and talk to people, encourage them, and not that we're taking cancer lightly, but trying to normalise every 2 years to do this program, I think is really important. And some of the strategies we have in place, as you know, is asking the community to be really proud and to take part.
Well, yes, it's good.
Councillor,
Really good, great presentation. And I think you should be a car salesman because you are very convincing. It was really good. In fact, before you open it up, I was going to sort of stand up and be a guinea pig, but just I don't think that'd go down too well. But look, thanks very much. Very good, and well done. I'll be first on the list.
Wow, that's so solid.
I'm sorry,
Oh, that's right, you're older than me. Eh? Yeah, good point.
I think you know the answer to that.
Councillor Cogan.
Thanks so much, Manai, for your presentation. Just to refresh with you as well, so what age group will this screening start from? And then it rolls out from, because I'm just, sorry, I'm having to revert my mind back to like the whole breast screening thing as well, and that's like 2 years until you're 65. I mean, is there a start and a finish time on this as well, or?
No, thank you for your questions. You actually raised it, it's something I didn't explain. So it is between 60 to 74. When we get to 10, we'll talk about cycles. So we're going to start our first cycle. A cycle is 2 years. So from June the 1st this year to June the 1st next year is the first year of a 2-year cycle. And that first year, this packet will go to people in those group whose birth around their birthday time, and it'll go to people whose birthday is on an even day, 22nd, 24th of a certain month. And the following year, that when the odd people, the people whose birthdays are on an odd day, will get that package. So some people will think, oh, why am I getting this? If you explain what's your birthday? Oh, you're probably going to get it in your second year. But some people go, no, I want it now. I've got symptoms now. Don't wait. Go to the doctor. If you've got symptoms of, you know there's blood, if your diet's changing or fluctuating, please don't wait for this. We've got people waiting for this. We're saying, no, please go to your doctor before you do this. So thank you for that question.
Okay, Councillor Lee.
Yeah, no, thank you. It's really interesting and good to see it being rolled out. Thank you.
So, thank you.
Councillor Kennedy, you popped up to the right.
Hey, yeah, just you touched on it briefly. I was wondering whether there was any merit in starting it sooner. Another question I've got is just the cost of that. So to get the kit, send it for the testing, what does that cost the health board per go? Do you know?
So there's two things. So for the participant, it's free. So doing the screening is free. If they have to go through a colonoscopy, it's free. But there is a cost here. Like people might have to travel to hospitals. There might be some, but some people who might do this who can't afford it. We can support those people.
Oh no, sorry. I was just like wondering the cost to the health board, for the test and that. But if you don't know, it's no stress.
No, sorry. Yeah, sorry.
Councillor Hartshaw.
Yes, that's very good. Thanks for that. It's just coincident that I'm just going to have a CT scan myself on Monday for it, just out of just paying for it myself. So, because I've been advised to do it at an earlier age. So, yeah.
Councillor Hart.
Thanks, Mike. It's really good to see the rollout. Thanks.
Paul, you're in the target zone.
No, not. Thank you, Your Worship.
I did say 50, that's the honest, but 60 to 74.
A great rollout. I just wish it was more extensive to the 50-year bracket would have been good, and also for a lot of other cancers. I wish that the government would be as proactive with others as they are with the select few ones, because it's something that's too easily neglected.
Presumably, once you get some positive results from these tests, the health system has got capacity to deal with the influx. This is going to cause a little wave of incoming work, isn't it? Can the system cope?
Yeah, it's a great question. So what wait times is the #1 risk in our risk management system on this. And so the Ministry of Health came down, they've been through a lot of wait time indicators. They've walked through the theatre spoke, and we had to prove to them that actually we're predicting with our numbers an extra 110 extra colonoscopies per year. And so, we've
throughout the whole country?
No, just for West Coast,
right.
just for West Coast,
right.
yeah. And And so we have to be prepared and show that the people that go through the National Bowel Screening Program, they won't be pushing people life who are already on the normal surveillance or doing normal colonoscopies. They have to roll together. And so we have to show them the systems. And when I get quarterly reports, the ministry is really hot on that topic, that we can do this program without being detrimental to other people getting colonoscopies.
Well, this seems like a brilliant initiative, brilliant program. The thing that if there are people watching, there are 2,000 people in this age group on the coast who are not registered with a doctor. If you're not registered with a doctor or medical practitioner, you're not going to get the screen. Really important, get registered so that you have a chance of getting it picked up early. Thank you so much for your presentation. We'd love to see you back at some stage.
If I may, I'd like to come back after to show you the results, just to give you an update of who's taking up the program, if I may, in a couple of months' time.
Of course, you're live streamed here, and we really support what you're doing. So thank you so much.
Thank you very much. Thanks for listening.
Thank you very much for that.
I'd ask Councillor to move that the presentation from Mania Cunningham, Project Manager from the West Coast District Health Board, be received.
Do that.
Councillor Davidson, thank you. Councillor Neal, all those in favour?
Aye.
Thank you. Thank you very much. Move on to item 8 of the agenda, which is the staff reports. And the first one is the financial report for April 2021. It's on pages 9 to 25 of your agenda. And Prabhath, the floor is yours.
Good afternoon, Your Worship, councillors and staff. I would like to take the report as read and happy to answer any questions you have to the Worship. Thank you.
Thank you. Open up for discussion. Councillor Davidson.
No questions at this point, thank you.
Councillor Cogan.
No, I don't have any questions at this point either, thank you.
Likewise, thank you very much.
Ian. Councillor Hartwell.
No questions. Thank you.
Councillor Kennedy.
Thank you.
Councillor Hart.
No, there was nothing to really highlight that's changed from last month, is there? I mean, we're still obviously getting all the grants in, and we're allocating that back towards the expenditure, and nothing much has really changed, is it?
No, apart from the grant installment 4.
Yeah.
So there's nothing much change.
No, people with that.
Paul.
No, thank you.
Well, look, all I can say is that when a report is put before council that is so comprehensive as you've put forward, there's often no questions. It's not a reflection on anything else. So thank you very much for that. Appreciate it. Could I ask that council move that the financial performance April 2020 report from the Finance Manager, Western District Council be received? Councillor Neal, Councillor Hart, thank you. Those in favour?
Aye.
Move on to council remuneration, pages 26 to 30. And Leslie's going to present the report.
The report is asking the council to reconfirm the decision of council in 2019 on council remuneration due to an error on the reporting tool to the remuneration authority. I'll take the report as read and answer any questions.
Councillor Davidson.
What I want to be clear about is that I stand today what I intended back in October 2019. Now, Audit New Zealand say that the wording was wrong.
Well, they're saying, well, the way they've looked at it, because of what the remuneration authority have taken, is that there was an overpayment on one and underpayment on others. But that was just, it was the wording that was wrong, it wasn't the intention. But there's a very inflexible tool that we actually sent to the Remuneration Authority, which it states on there how much you're paying extra for a deputy mayor, how much you're paying extra for a chair one, chair two. So we filled it in as we thought we should have done. But apparently what we should have done was just to take all that out and put the exact role. So deputy mayor and chair of the capital crowd. So we should have actually been specific as to what they were. And it's because of the way we did it and the way the Remuneration Authority picked it up, they made the assumption that the amounts were different.
So what's in front of us now?
It's what you determined in 2019.
Beg your pardon?
Is what you determined in 2019.
Yeah, and also that New Zealand, Audit New Zealand, they accept that now.
They know what happened.
Yeah, well, I'm saying,
yeah.
the question is, do they accept the resolution in front of us now?
They accept that there's a perceived overpayment, but as far as they're concerned, they've got the Remuneration Authority declaration as such. And they say, well, until that's changing, which is what we're going to do now, hopefully, they'll just see it as being still an overpayment.
Do they accept what?
They know what's happened.
Do they accept that now?
They do, but they won't change it. That's why we've got to go through this again.
Just a clarification, following this report, they will accept the outcome, but they were asking for council to resolve that this be presented today to close off that non-performance.
Councillor Coe, thank you.
Yeah, and so, no, okay.
Sorry, I was just going to say, all the audit asked us to do is to contact the Remuneration Authority. That's it. That's what we've done. So they'll close that off now.
Oh. So it's just not individually listing for David that he was deputy mayor and on as chair of another board.
Yeah, it kind of was. That was the issue.
Yeah.
The way the tool, and we filled it in thinking we had to fill in those fields.
Yeah.
So the way that worked was you could fill in an amount for the deputy mayor, and then you put the amount that as a chair, and the same for any of the chairs, 2, 3, 4, or whatever. But the way we actually resolved on it, what we should have done was just add them together. So add that bit together, and that would have made it right.
Yeah.
Councillor Neal.
So instead of saying A and B, actually we should have just gone C.
Yes.
So,
Yeah.
thank you for your explanation, Leslie.
It sounds a bit convoluted, but.
Councillor Kemp.
Thank you.
No, thank you. It's a little bit confusing, but yeah, no, I'm happy.
Councillor Hartsham.
Yes, no, I'm happy enough, thank you.
Councillor Hart.
No questions, I understand it.
Paul.
Semantics caught up in the bureaucracy.
Yeah.
I just hope there's going to be a headline around this as there was to say deputy mayors over.
Yeah.
Disclosure of interest for deputy mayor Carruthers. There is no question that what has been paid is what we resolved to be paid, and this is nonsense. However, we are bound by the bureaucratic nonsense that sometimes overwhelms us all. Would someone like to move, or council like to move that A, council receive the report, B, council resolve on the council remuneration as set out in the remuneration tool to take effect from July 2021, and C, that council request staff to inform the Remuneration Authority of this resolution. Councillor Hart and seconded Councillor Cogan. All those in favour?
Aye.
Thank you.
Just off the point, we should like to make an observation that as councillors, we're the lowest paid in New Zealand. And regional councillors, the base remuneration, I said, is 52,000. And so Western District are right at the bottom of everything. And that's simply because of the population basis that determines these things. And it's not fair. Not appropriate.
And I think more important, we as councillors resolve it. We have the ultimate responsibility. That's the end of the story. All right, let's move on to the next item, which is the welcome, Francois.
Good, everybody. Sorry for lateness.
Filling the coal bucket, will you?
Sorry.
Filling the coal bucket.
Yes, plenty of coal. Plenty of coal.
Thank you. The next item is the adoption of the terms of reference for the Hokitika Waste Water Treatment Plant Project Oversight Subcommittee. It's on pages 31 to 37 of your agenda, and Chief Executive to present.
Yes, good afternoon again, councillors and worship. This report is concluding the discussion we had last month around committee structures, where I proposed that with the capital projects for the Hokitika Wastewater Treatment Plant being such a significant project, one of the biggest ones I suggest that council's ever undertaken, that we honour our memorandum of understanding and include iwi as part of the governance oversight group to lead this project. So this report is to actually put that terms of reference of what that governance group would look like and enable. I've shared this prior with both Francois and Paul before I finalised it, and have agreed on the concept and content. So I'll take it open for questions, Your Worship.
Thanks, Simon. Councillor Davidson.
Yes, thanks, Simon. How many meetings do you think you had per year?
So predominantly the work will be upfront. So we expect, because the idea of the subcommittee is to actually develop the objectives and the vision of what the project's all about. So most of the meetings will be within the first year of the project. Following on from there, it'll be updates to the group to make sure it's on track to those objectives and values. So hard to say, but I would expect the first session will be a workshop, followed by updated meetings around design works, etc. So potentially one every second month, starting out, and then probably getting out once per quarter.
Okay, thank you. And the other question is the iwi representatives. Are they going to be the same people going along to each meeting?
We hope so. Obviously, this is a very long project. We anticipate at least 4 years project, so it really comes down to the iwi representatives being available. They may change, but as long as the objectives will be well set up front, so we don't expect that mandate will change accordingly.
Councillor Coburn.
Yeah, I don't have any questions with that at all. Very clear on that. Thanks, Simon.
Councillor Neal.
Yeah, sorry, Simon, can you just clarify, the subcommittee still comes back to council for final?
Correct. So it's a subcommittee of capital projects and tenders. We are expectation that the oversight committee will set the tone and the content of the objectives and values, bearing in mind that the chair of the capital project and tenders committee will be also on the subcommittee, so ensure that we have a strategic alignment through both of those. So yes, so it'll still come through the capital project and tenders for approval, and then obviously as full council as an update.
Thank you.
Francois.
No, I'm all good, thank you.
Councillor Kennedy.
No, it's really good. I think it's getting the attention that it deserves. It's a major thing. And I suppose in terms of, it would be nice to have the same people all the way through, but as we're elected members, that may change, but it would be nice to see hopefully someone or a few people can carry on through the whole process for, yeah, would be good.
Councillor Hartshorn.
No questions. I'm fine with that. That's a good thing.
Councillor Hart.
No questions, but it's going to be quite a substantial amount of extra work, isn't it, for that committee up front?
I think up front, I think the biggest area will be around workshops, and the subcommittee won't be working on their own. The project managers will take the lead and work with and just do all the collation for the committee. So all the committee's there to do is provide guidance and direction and make sure it's on track. So the donkey work will be done by project contractors and advisors for the committee as well, key stakeholders that the committee can call on.
Terrific progress on this, and just to clarify that Francois and I won't be on the oversight committee because we sit on the capital works and tenders committee and on the council, so we have that helicopter view over all of the project. So those 4 positions will be for the Runanga, both Runanga to fill. So we have some people in mind for that, and I see that it's for the duration of this training. So
just to clarify, the resource consent for this project for our discharge runs out in April 2026. So the project has to be designed and resource consent applied for, accepted and built by that date is the target. So 4.5 years away.
Thank you, Simon. Is Stantec is are they the project managers, are they? Is that what?
Yes, they've been contracted.
Not so. Has that formally occurred? Did we do that as council?
No, that was through staff. So they will take the lead and to take the lead with designing the scope of work, and then we'll then go out to tender for tender process.
Yes. So presumably the oversight committee would have the power to obtain other technical expertise or advice if necessary.
I think in terms of reference, anyone then being able to second advice as required, so they can get peer reviewed if they think actually that cost would have considered under the project.
Okay, thank you. Look, thanks, Simon. I've just got a couple of points. At what point will councils around New Zealand come into the real world? And I say that, I mean, $250 for a meeting. This is the biggest project that this council's ever undertaken. The councillors that sit on that committee should be remunerated, and the $250, I thought, Mr. Dean,
Just through your worship, we took advice through other similar councils within New Zealand, and it's actually more than what other councils pay. So,
so do councils get additional remuneration for
the councils? No.
So, you know, this is going to be a considerable workload, isn't it?
Once again, just referring back, most of the work's not going to be done by the governance group itself. There'll be documentation to review. The only, I suppose, significant workload will be the workshop itself, and understanding what the values and objectives actually are. So I expect that to be half a day's piece of work.
But Simon, just to interrupt it, what's the input of our staff going to be? Because presumably we'll be receiving reports and advice from Stantec that will be vetted before it comes to us as part of the process by our staff.
So we'll have a project lead from staff, but most of the work has to be done by the contractors or consultants themselves. So that's what we're paying them to do that. And we'll be critiquing it to make sure it is aligning with the right objectives.
Yeah. So that's sort of kind of filtering the input into the committee is being filtered by staff.
Yeah. So
that's an additional cost to council, isn't it? Having
stark overdue.
So just bear in mind that the $6.9 million we got for the Three Waters Reform project, 1.5 million of that has been put aside for this project. And that's that's the allocation we're using for the outsourcing of Centec and any further design work.
I guess and I'm happy to go with the recommendation. I guess the point I'm making is that if Evie is sitting out there and looking to appoint two people who can actually add value, so they're going to have to be, they're not going to, four people, actually, sorry, Paul, they're going to have to add value. $250 buys you half an hour with your lawyer. It buys you, it doesn't buy you anything. It's just my view, but
10 minutes.
10, well, it's a reality. We seem to be. It's important that we get into the real world when it comes to costing, and this project is government funded, and if we got a consultant in from on a daily rate, we're paying $800 to $1,000 a day. Of course, they're accepted. They're at a high level. I've had my wee ring.
Your worship, I'm happy to change based on an hourly rate if that's what council would prefer.
But your worship, the other issue there is that the people on the committee have to add value commensurate with the remuneration. That's important, isn't it? We need people on that committee who have the capacity and ability to deal with these issues, which are far from straightforward.
I just think it's a major project. It's very complex. It's out of my league. So it needs people with expertise. And I've made my point, and I think we need to be. Yes.
Just if I may, just to draw to council's attention that in terms of the way we determine the fees, it's using the cabinet fees framework. So within there is a system that is points graded in terms of the technical capacity that's required of people there on the committee. So that is the mid-range fee, but there is a broad range within that. So if with council's permission as part of it, it's just a case of giving authorisation for the CE to utilise that framework based on technicality, and if that fee fits within the framework, not having to come back to council in terms of what that fee may be. But the 250 is what was settled on based on the initial assessment. But there is movement within the different bands of that cabinet framework fee.
And would that be within the delegation of the chief?
Well, as I say, if you give the chief executive the delegations to use the cabinet frameworks fees framework, then he can determine what the fee is as appropriate, and it can be adjusted over time as well as the technicality or the amount of time or the scope that's required might change as well, as against them having to come backwards and forwards. We just require something in the report that should audit ask how the fee was set, we're able to state that it was set against this. So we're able to say to them that we have used the cabinet fees framework, what that fee may be if you give the delegation to the chief executive to determine where that might sit.
Just in case we tick the wrong box.
Well, we'll be the right box with your permission.
Councillors, sorry.
With the fee setting, and I think it's said in there that the fees are unbudgeted. Is that right? Can that be part of that paid through that funding we're getting for that project or not? Or is it unbudgeted? It's going to be on council to pay that, or can it be part of that? What it was 1.9 of that Three Waters?
I'm actually not sure if it can come as part of a project cost for a committee of council.
Yeah, I just want that's a question. There's no in the plan. There's no allowance for committees because you've obviously got to have these committees to get this.
Same as staff time can't be put against this as a budget cost or the budget cost.
Yeah, which is not quite, which is odd. But
I mean, if you outsourced it, then it could be charged.
Yeah. So it's different. Yeah, okay. Just a question. Yeah, okay.
Councillors, if you're happy, I'd like to add in that we delegate to the chief executive the ability to use the cabinet fee structure and add it to the rest of the resolution there. Is that, would that be something that I could put forward, comfortable with?
Just one comment, in the same way that you refer to what lawyers may be earning on an hourly rate, we've also got a lot of ratepayers that are earning the minimum wage. So there is that broad spectrum, and they are in effect paying for this as well. So it's relatively both ways. Yeah.
I'll mention that to our lawyers next time I'm talking about.
I'm sorry.
A very good point. Councillor Kennedy.
Yeah, sorry, happy to receive a report. I just think, has any thought gone into those Hokitika ward councillors, relieving them of their other committee duties, whoever it may be, Councillor Martin, Deputy Mayor Carruthers, or Councillor Davidson, so they can sit and spend more time on this wastewater committee? Perhaps that's one way of doing it, so they're not overworked.
That's certainly a good discussion point, and we will pick that up with the four that have involved. So perhaps I'd like to move that council receive the report. Sorry.
Sorry, just a comment. The following from Councillor Neal. I think we do have to be conscious, of course, that it is an unbudgeted amount, and the rate rise that we're already faced with needs to be factored into this. This is the standard for other councils. It may be lousy, but that's what for instance, the regional council pays. I'm just saying that I don't want it to be seen as another reason why the rates are going through the ceiling.
Feel around the table could well be we stick to the recommendation of the report. On that basis, I'll move that A, council receive the report, B, that council adopts the terms of reference, including the membership for the Hokitika Wastewater Treatment Plant Project Oversight Committee, C, the terms of reference for the committee to be added to Part 3 of the Delegations Manual, delegations to standing committees and other committees, and D, any change to the committee structure be updated as required in the local governance statement. And I'd ask if there's a second for that report recommendation. Councillor Neal, thank you.
So, Bruce, just to clarify, are you saying that in the light of the membership of this subcommittee, that may affect the membership of the other committees that we looked at last month, Simon?
So just through your worship, that would have to come back to council for resource at a later time if we were going to change the membership. So we can review that as part of a piece of work and just trying to balance the load of committee members.
Just to note, if that's right, that if you do change membership of some of those committees, as in the chairs, that will affect remuneration.
So I would try to avoid changing chair roles.
Yes.
And just purely membership.
Yes, absolutely.
Just another question though. Is there any particular reason why it was to be some of the Hokitika ward councillors? It's just probably something that I, question a lot at council, that I know we were elected in for our wards, but there's only 8 of us, and aren't we responsible for the whole of the Western District? So should it have been restricted to that it would be just Hokitika ward councillors that would have been eligible for
your worship. So if the same thing was happening for Francis Joseph, I would have selected both Councillor Kennedy and Councillor Hartshorn as more connected to the community down there. That's purely the reason and justification why I thought Whakateka. So wherever it would be within the, the wood zone, I would suspect that you would want to represent northern zone as your ward. That's purely the justification I used. If there's any challenge.
Do I have a second? Councillor Davidson. Those in favour? Thanks for that, Tom. You're actually next on too. We've got TC. Oh, TC. Sorry. No, that roads. The next item on the agenda is the road naming for unnamed roads in Kamara and Takatai. It's on pages 38 to 48, and TC is going to drive us through the report.
Good afternoon, Mayor, councillors, and as you're aware, members, this report was brought to you last month, but the report wasn't really complete in its entirety in terms of process that has to or should have been followed. What has happened since is it's been re-emphasised by people that have bought properties on the road or are coming near the end of building, that due to, particularly for the Takatai Terrace development, not having road names, they are unable to connect to critical services, being electricity, communications, fibre. But also, as now highlighted in the report as well, in terms of a risk to council, that we have an unnamed road development that in the event of a 111 emergency, should people be there, you will not have the ability for services to find them, or there'll be delay in emergency services being able to find these locations as well. So the report has come back with some amendments through the report and more information. Also attached for your reference is the road naming policy for unnamed roads. The options as presented remain primarily the same, but with some additions in that as well. And the reason that it still follows through with the option 1 and option 2, particularly for Takatai Terrace, option 1 being Ricochet Road, option 2 being Hall Road, it's just following through a preference that was put forward from the developer. So Ricochet Road being the first preference, Hall Road being the second. You'll recall at the previous meeting, there was not much favour for Ricochet Road at the time, and also Hall Road, and it was asked that council staff go back and have a look at some alternatives. Discussion was also had at that meeting in terms of Māori names that might be applicable, but due to the shortness and the urgency in terms of requiring a name at least for Takatai Terrace unnamed road, then what we've brought forward is in terms of from the environmental side, some names there for consideration if Ricochet and or Hall Road still means not seem to be favourable, and that is looking at native trees that are quite prominent in the area. And yes, there are Kahikatea trees there as well, but we have already used the name Kahikatea in another part of the district just outside in Whakateka. And as part of the naming as well, you try not to duplicate road names, because that can also cause confusion for emergency service and delays or being responded to other places. So that's just to pick up on the issue. Boundary Road is in there. If we are able to resolve that today, that would be favourable as well. However, because as written in the original report, the current property on Boundary Road is seen with an address of Ordera Road or the State Highway, that is one of council and members will prefer to go out in consultation for Kamara. Then we can, because it doesn't impact on that address as significantly as we have the Takatai development terrace. So it's really in council's hand at the moment as to whether they favour the first preference of the developer being Ricochet Road, the second being Hall Road, or if there are any of the Māori names represented in terms of trees or birds in the area, or should another name be forthcoming today, so that as a minimum we could at least from this meeting have a name for the unnamed road on Takatai Terrace, because there is still then another process in terms of that name being forwarded to LINZ for it to be gazetted, for it to then be registered, so that people can then have an address assigned.
Thanks, TC. The issue here is quite a real one. There are people who can't get the power on, can't get the phones on. Councillor Hart has been assisting one ratepayer to try and get this thing sorted. We'll open it for discussion. Let's get it sorted. Councillor Davidson.
No, I've got no questions with it.
Councillor Cogan.
I'm happy to go with the recommendation, councillor.
Councillor Neal.
Yeah, I still don't like the names. Boundary Road is inside, there is a boundary street in Greymouth, and although it's not within our district, maybe it's just because I don't like it, but I think we should use this as an excuse. And I would go with some of the, possibly the suggested Maori names, but input from the iwi as to what's particularly relevant there. And obviously making sure that we don't use ones like Rimu or ones that are already in the area.
Councillor Kennedy.
No, nothing. Obviously, the thing that still grinds my gears is $300 the council's supposed to be paying. It seems to be at odds with our road naming policy, where it says 4.1, when a new name has been confirmed, developer of the subdivision pay the council for the sign. That's the only problem I've got with it.
I can see why that would grind your gears. Francois.
I'm not that fussed on the names, to be honest, and I know that Paul and myself will be able to come up with some more appropriate names if we had the opportunity. But yeah, it is a private subdivision. I get that, but the names sound pretty shocking to me. But yeah.
Councillor Hartwell.
No, I'm happy to go with the recommendation. Thank you.
Councillor Hart.
Yeah, I'm happy to go with the recommendation because I've been a bit involved with this, and that they really need a road name so they can get facilities on there. They're 3 weeks away from completing a build and can't get any facilities up there. So it just needs to be sorted.
Yes, I understand that. Fully understand the urgency, which I might add is urgent now, but it's been years that this has been allowed to just drag on. Hence, that the developer, in my view, their right to suggest or recommend the name for the road has expired because they didn't bother with it all those years. And also, as Councillor Kennedy says, now left for the council to pick up the tab of how much it's going to cost the staff time and the signs, whereas it ought to have been the developer. My next point is that I'm pretty disappointed with this, that a month has gone past since we raised concerns about it, and it's come back with basically a copy and paste from the same report from last month. The only thing that's changed is to put in there about some possibilities being trees and birds names, which with respect, I thought that we'd moved on in this country from naming things after birds and trees as token Māori names. We did suggest even at the last meeting the possibility of a local name that was there. That was just off the top of my head, but the officer didn't come back to us, didn't engage you at all, didn't come back to Francois and I and say, hey, okay, hear what you're saying, what's some ideas, how can we do this, because there is urgency. So I'm not happy with it. I think it's rather colonial, to be honest. We've had 160 years where our names have been supplanted by European names, and it's not too much to ask when the opportunity comes along for a Māori name to be given. And I think it more than a call-fight tree, for instance. As for Kamara, again, I'm disappointed that the officer hasn't yet canvassed the community to ask, well, is this really the local colloquial name for that road? Because I really have no idea. But as we said last month, the debacle over Kapatia Dam versus Dillman's Dam at Kamara was very real, and we just don't want to have a repeat of that. And so I'm not happy about just rubber stamping Boundary Road because one person says it. I really think it needs to go back to the community.
Have you any brothers? Well, how do we resolve this? Well, what are our options? If we have people who are weeks away from moving into the house, they need a street name. So the question is, can we come up with a street name here, or do we just rubber stamp the report?
I'd like to see us going back to Paul and Francois, if they're happy to, and I don't see, is it possible to have some suggestions coming through to us via email? Because we did ask for that last month, so I don't think it's fair to put the pressure on us now.
I think there's
We
have no choice but to adopt these names, but learn from learn a lesson for the future from this situation doesn't happen again.
And doesn't
Well,
that
because we're
policy
just going to let it roll again.
allow for that like a developer has to provide names before?
Well, it does say that now with new roads, for new roads being formed, the developer is invited.
So they have to have been named before you even, subdivide them, potentially.
Understanding the urgency to progress it through your worship, can I suggest that I liaise with Paul and Francois basically the remainder of this week and early next in terms of a name, and then with the name being appropriate, circulate it by delegation that we don't have to bring a report back to council, because the policy does allow for that as well. It's necessary to have to come back to council just to agree name and bring that back. But as I also said in the report, the Boundary Road at Kumara is not as urgent, even though the one owner on there maybe there is still time allowed for that, because they are seen as having an address off State Highway 6 or Tierra Road anyway, so that's not urgent, they can be found. There is no reason why we can't consult on that one and just find out what the locals, or even in terms of Māori interest in those areas. But for the urgency of Tai Terrace, through delegation from council, if those intendants are agreed, just give me that ability to consult with Paul and Francois and try and have something finalised by basically Wednesday next week, thinking gaps for the weekend, and then we can progress.
Councillor Davis.
Yeah, through the chair. Will that have any impact on anyone else?
The only impact in such is basically in terms of the developer, that the policy allows for an alternative name to be determined if the names given by the developer aren't found to be suitable, cause offence or any other such things. And with the discussions in the previous, there was definitely not favour on Ricochet Road. There was, well, all roads we get to, but it's just, as I say, to give the option in terms of coming under the name of former council.
So you'll be liaising with the iwi plus the developer?
Not at this stage, because the developer now, it's the case of how the report and policy goes. If we can come up with a name that's favourable by email to council, and we agree via email to council that any name suggested by Paul and Francois is the preferred name, there is no need to go back to the developer. If council say no, they don't approve that name, then we would default back to option one, which would be the Ricochet Roads and report.
Well, let's be very clear here. We need a name for Ricochet Road. So we go through a process where we approve the report, and subject to the name being confirmed by iwi. Is that where we're going?
Yes, just clarification, we're talking about unnamed road, not Ricochet Road.
Yeah, no, unnamed road, but that's option one.
Yep.
Subject to consultation with iwi on alternative name.
I need to nail this today.
As long as it's completed by next Wednesday.
Councillor Martin.
Thank you. Apologies for lateness. Probably missed the earlier part of this, but it looked like a rehash of last month's report. I thought there was work that needed to be done between last month and this month to get something for this month. And from my perspective, you've got people up there scrambling to try and get letterboxes and legal titles and all sorts of things sorted. appreciate process and I respect the need for iwi consultation. That's why we went that way a month ago. I mean, it's not fair on those people that have bought property to even, to not make a decision today. I personally don't believe that we should ever be presented with two names. And I think the developers, as the developer of the subdivision, should, through our policy, have a process for selecting a name, and then it comes to council to be ratified. And they have, as far as I understand. I don't even know if anyone in the staff has spoken to the developers of that subdivision, but they have a preferred road name. So, I think we can't just. I hear what TC's saying, but it needs to involve the developer as well.
Thank you. Councillor Martin missed this discussion, but in my view, the developers' right to name the road is expired because they didn't bother to do it when they built the subdivision, and now it's fallen on the council to bear the cost.
Fiona, could you clarify that?
Yeah, can we get clarify?
I'd just like to add in there that the policy didn't exist when the subdivision happened, so it's actually a bit difficult to belatedly blame the developer. Generally what should have happened is that yes, a decision on a name should have been made, however, he wasn't guided to do that at the time. So this has become a late in the piece process.
Yes, but although it's been the informally, that's been the process for many years as for subdivisions. The developer has the right to name the roads. And may not have been policy, but certainly the practice.
The developer has the right to name the road.
Yes.
Right. And he hasn't done so.
Well, some years have rolled on and it wasn't done, and to now, with a matter of days in front of us, to say, well, the developer ought to be involved, and I think is a bit rich.
So it begs the question, if, for example, the developer had gone out of existence, when it's not around, who then has that power? Must be the council. So therefore we should, you're right, I think we should proceed on that basis, that it's our right. That's a mark.
Just to throw another spanner in the works, I understand that when that whole subdivision was put in, it was all named Takutai Terrace, and all of the roading network from the developer's perspective was going to be called that. And then internally through council, there was a requirement to have that second road named something different. And then there's been no consultation with the developer outside of please suggest two names. They've only done what they've been asked to do.
Clarification, Fiona.
So my understanding is that the roading standards, the road naming standards wouldn't allow for that entire piece to be named the one name, which is why, there was an approach to the developer to then put names forward.
Yeah. So it's a bit of a mess, isn't it?
Well, look, we're not leaving here till this is resolved, because there are people, our ratepayers, our residents, who are building homes, who can't get a letterbox, they can't get power, they can't get a phone. Yeah, would someone like to suggest a way forward that we can resolve?
I think we should be going with what TC suggested, because really, and I'm sure that Paul and Francois could come up with something before Wednesday. I would imagine they've probably got words sticking through their brains right now. Certainly, I don't think it's going to take long, and a few days without a letterbox. If it's been weeks and weeks in the making, another few days isn't the end of the world. And actually, these sorts of things happen all the time. We still have arguments with Spark about if we've got an address that exists.
Not under our watch, councillor.
Does it need to be stretched out to Wednesday? I mean, it's Thursday. Could it not be stretched out to Monday so that it's addressed?
I've only suggested Wednesday in the sense that I'm not conscious of the availability of Paul and Francois, knowing meetings that they are also available, other things to be with. It can be done tomorrow. But
would it work for you guys to get an answer back by Monday?
Paul, do you want me to ring you tonight and we'll do it now? Do it tonight. I mean, it's pretty simple from our end.
We can
love the way you do it.
We can do it pretty. We can do it pretty swiftly.
Right.
However, of course, the
Sorry.
point is it is also a little unreasonable to, if it had been more difficult and it had required more consultation with the whānau, and we thought we had that opportunity because a month ago we had this, and nothing's happened.
I can appreciate that.
Look, that's a reality, that nothing has happened. However, we're here to make a decision. What are you suggesting is
I suggest option 4, which is council allocates name to the unknown name road within Takutai Terrace developments and seeks public consultation for the unnamed road to Kamara, which then enables Paul and Francois to determine an appropriate name for Takutai Terrace without having to come back to council for the Takutai Terrace developments.
Okay, is that something that everyone can live with?
That was going to be my recommendation, that there's a compromise here that maybe we name Takutai Terrace because it's more urgent, and we open it up for iwi for the suggestion for Kamara, because the Takutai Terrace is urgent. I don't like, it needs to be done.
Yeah, but if Takutai Terrace could be done by Monday, because Francois and Paul are saying, yeah, and I understand where you're coming from, that it really should have had much longer, but in this circumstance that we're in now, it hasn't, and it is unfortunately now what it is. But if you guys could come up with and agree to a name by Monday, then at least they're still, it's only the case of another 2 working days and they will have their name.
Francois is giving a thumbs up to that.
And if I can just ask for a slight amendment to option 4 so that it qualifies if it's looked at in the future, that council allocates a Māori name, the unnamed road within Takutai Terrace developments, and seeks public consultation for the unnamed road to Kamara.
And the public consultation will include iwi consultation.
Oh, absolutely, but as I say, there is no risk in terms of the risk posed to council for Boundary Road as it's named now, as there is for Takutai Terrace.
The resolution that's proposed is that council allocates a Maori name to the unnamed road within the Takutai Terrace development and seeks public consultation for the unnamed road at Kamara. And to receive the report, of course.
And that the policy would be updated to reflect that future.
Just separately, having gone through this process, we have put it into a review to this policy because it's a bit light in some areas.
Okay. So we can note that go in as an addition. Yeah.
Councillor Hart, I invite you to, Councillor Martin.
I just want to say it's all very well that we got process Mickey Mouse and, we haven't followed the rules, and I understand the urgency, but I think that the developers have done everything that they've been asked of by the council. And now we're saying we don't accept the road names. I think that conversation needs to include them as well, because it's kind of all weird. The whole process is weird. And I feel that just throwing it to Paul and Francois and saying you've got to come up with a name fixes the issue of giving it a name, but it doesn't deal with the policy, which is actually the developer suggests a name. And we consult with the developer. Maybe the developer can be part of the meeting with Paul and Francois and reach a nice compromise, which would mean that the recommendation from TC would go through. But I just feel very uneasy that staff and councillors are meeting to decide a name without any involvement from the developer.
Councillor Hartshall.
Yes, I've got the same concerns as Councillor Martin. The developers has no say in or no input into it, whereas he's actually built the road, he's actually developed the land and sold the sections. I would have thought he would have had some input into it.
Easy.
In terms of the policy, which in itself is loose, it enables the developer to be involved in that, but in terms of under the legislation itself, the Local Government Act, council does not have to engage the developer in naming of roads if it so chooses that path. Not a great path in terms of development, but they can. So that's in terms of section 319(1), where council has the power to respect the roads to do the following, and that's to name and alter the name of any road and to place of any building or erection of any abutting road plate bearing the name of the road. So council has that authority, but as I've alluded to at the beginning, it would be nice in the perfect world that when subdivisions and developments are coming in, it is all part of that on the plan, so it's considered at the time of the development being approved. In this case, guidance in the past involving no one around this table wasn't correct or wasn't followed through, so it has left us with a section of road that has sections that have been sold, houses that are almost completed, and time is not in favour of either the residents on that piece of road or for council in terms of risk.
Councillor Davis.
Yeah, I think we'll be, the council would be acting in good faith if we liaise with the developer.
Paul and Francois, your views on that?
Yeah, I don't mind.
No problems?
Let's
Francois?
go. Let's go.
Okay. Right.
Okay.
This is very good, because this is a matter that has to be knocked over. I'd invite the council to move that council allocates a Maori name which is put forward in consultation with the landowner and iwi to name the unnamed road within the Takatai Terrace developments, and it seeks public consultation for the unnamed road at Kamara. Does that cover it? Someone like to move it? Yep. Councillor Davidson, thank you. Do I have a second? Councillor Neal, those in favour?
No.
And also, can we move, can I have a councillor move that the report be received?
Yeah.
Councillor Neal, do I have a second? Councillor Davidson, those in favour?
No.
Aye.
Thank you for your perseverance there. Right, Simon, capital projects before or after? Again?
Quite a long.
All right.
Long road.
Okay. The next part of the process is citizenship. Or I wonder if we've got time. I want to see if everyone's near me, first of all. Wondering whether the administrative resolution, Leslie, that you wanted to speak to. Is it a short items, long items? Okay.
It's just really
We'll move to excuse me, item 9. And Leslie will speak to the matter.
So basically, it's just an administration resolution. When we use the council seal, council has to remember that we use it. And what we've done as risk management tactics is to spread our investments over another bank. So we have to open an account with that bank to be able to use them for investments. To do that, we have to use the council seal.
Okay, administrative, I'll invite, is there any discussion on that? Okay, would someone like to move that council confirm its seal be affixed to the ANZ Bank Master Mandate? Councillor Cogan, Councillor Neal, those in favour?
Aye.
Fantastic. Will you, June? Right, and the next part is we have a citizenship ceremony. And a big welcome to all of you that have come along here today. It's great to see you. I'd like to extend a very warm welcome to everybody here today, including the families and supporters of new citizens in the Western District. The order of proceedings today is we will listen to a short video and welcome from the Governor General, Her Excellency, the Right Honourable Dame Patsy Reedy, and also the Honourable Jan Zanetti, who's the Minister of Internal Affairs. We'll then sing the National Anthem of New Zealand, After this, we will move forward and present our 2020 new citizens that received their certificates by post last year. Citizenship ceremonies in 2020 was cancelled due to COVID-19. Westland District wish to also welcome these new citizens and will call them up to receive their copy of the New Zealand Citizenship Story from Internal Affairs and be presented with a magnificent little traffic tree. There will be a photo opportunity during the ceremony. At the completion of the ceremony, we ask that you remain seated. Council will then adjourn for an afternoon tea, yourselves and your guests. And at this stage, a further group photo with myself will be taken, Deputy Mayor Carruthers. We hope you enjoy living and working in Westland. It's a great honour to be part of having you here today and being part of the ceremony. It's a great honour for our council, and I know that it's something that we all look forward to, for a long time. So I think we'll move to the video first.
The bluff, the cape, steaming sands, boiling plates, white water swells, bridges of old, deep clear nights, open shows. Winter season brings out the best, summer nights in Auckland. And my father used to say, oh, we came to this land of plenty, and we came to this land of hope. We came to this land of good times, and we came to this land of love.
Kia ora koutou. As Governor General, I represent Her Majesty Queen Elizabeth, the Queen of New Zealand. On Her Majesty's behalf, and on behalf of all of my fellow citizens, I'm delighted to extend a warm welcome to you, our newest New Zealanders. We all belong to a nation of immigrants. We understand what it means to leave a familiar world behind and look for opportunities in a new land. When you become a New Zealand citizen, you will join one of the most diverse populations in the world. Your skills, commitment and cultural traditions will help shape the future direction of your communities and our nation. You'll enjoy the same rights and take on the same responsibilities as your fellow New Zealanders. Our history will become part of your history, and your future will become part of our future. Thank you for choosing to make New Zealand your home. I wish you and your families every success in this next stage of your life journey. Noho ora mai. Welcome.
We came to this land of plenty, and we came to this land of hope. We came to this land of good times, and we came to this land of love. We came to this land of love.
Hello, I'm Jan Tinetti, the Minister of Internal Affairs. Today I'm here at the National Library, home of the He Tohu exhibition. The exhibition is home to the iconic constitutional documents that have shaped New Zealand, including Te Tiriti o Waitangi, which is the partnership your new home country, Aotearoa New Zealand, is built on. It gives me great pleasure on behalf of the government and the people of New Zealand to welcome you as a citizen, as a New Zealander in every sense of the word. Your decision to become a citizen reflects a lifelong commitment to our country. In turn, it can be passed on to a future generation wherever they are born. Some have been here for many generations, and some, like you, are new. but we are all New Zealanders, Kiwis. Congratulations! Until today, New Zealand was your home. Now it is also your country.
There's a story I know, we all leave and let go. There is nothing to hold us. In a moment of time, when the fruit becomes wine and the thought becomes the memory, all your sorrow, maybe tomorrow will fade away in the air. Trying to please me, making it easy, it won't be there, it won't be there in your life, in your life, in your life, oh, in your life.
Now I'd ask you to stand and join us to sing the national anthem. Well, this is the exciting part. Are you all set? You ready to go? Sebastian. Sebastian, you're the first off the block. Welcome. Absolute pleasure. This is a book here from Internal Affairs. It sets out your rights and obligations as a citizen, and it's something that it's presented to the new citizen. We also have. Now these trees are much better than last ones. Last ones were like nice. Actually, you can your family would be like the council. You only get one, if you want photo stating, this is the only time you'll get a chance to do it. So be very forceful on what you want. Okay, how would you like? Miss Deputy Mayor Crowther. Right. Inside. Can we just have one line? Can we I see a future Marys here. One day you could win this. That'd be great. Right. Thank you so much. Karen. Twice. Congratulations. It's for internal affairs. It's first eye. And of course, you're not over the treasure. Fine too now. Technology's never had. Thank you so much. Renee, did I get that right?
Yeah.
It's always hard. Good to see you. Yeah. a great place. Westland's awesome, West Coast fantastic, and you're now Kiwis, so you have a right to go wherever you want around the world and wherever you want in New Zealand. And you wear the badge of being a Kiwi with honour, because it's great to have you here. Yeah, how about joining us for a cup of tea and a sandwich, a bit of something? We've got some dog biscuits here. Come on through. It's something that we do. And we'll adjourn the meeting. Thank you. Thank you, Your Worship.
Give that man the silver chair.
Yeah.
Give him the goal.
Do we have two? Yes, we have.
Councillor King is online, Commissioner.
Is online, fantastic. So we'll, what are we, 45, 346, and recommence the meeting. Just record an apology from Francois, who's left the meeting. And we'll move on to capital projects update, which is on pages 49 to 75 of your agenda and presented by the Chief Executive.
So there's a lot to get through in this presentation. So what I'll try and do is just touch point on each slide as we go through the most important factors. If there's anything within the slide, I suggest we ask the question at that point rather than waiting until the end. So we'll just come back and forth.
Yeah, Councillor, just raise your hand, see if you want to ask a question.
So currently we've just completed a couple of works under the Three Waters portfolio, Tankerton Street stormwater pump upgrade station and the Haast reservoir upgrade. And so each of these projects are in a different category. So this is water supply, this is within the annual plan. So currently with Fox wastewater treatment plant upgrade, that is currently underway and we've contracted that, if you recall, several months ago. We have TIF funding for this project. It's highly leveraged, so this is a good project for council. Final design specs are still being worked through for that project. Arahura water supply treatment plant. So that has also been contracted and awarded, and if you pass there now, you'll see earthworks getting underway, so that project's started. The others are minor. Any questions on those projects? Wastewater treatment plants, so the whole particular one, as you recall, we have started that process. Contracted Stantec as our lead project managers and just formed subcommittee as of today. Like I said in the previous presentation or report, this is a 4 to 5 year project if you include commissioning. So it is one of our most significant projects. Wastewater, Fox Bassett wastewater treatment plant improvements. This is also underway. We finally have agreed with the landowner access agreements. So we're getting that one moving. Any questions on that? Just a point of note, the Franz wastewater pump station upgrade was a fully funded TIF application, so that is now completed. Stormwater, our big issue was Livingston Street, just under $1 million worth of works to be done there. So Stantec have actually completed, starting to finalise the design concepts for that. We've decided to plant Jolly Street and carry that over and focus our efforts on Livingston Street. That will be potentially complete or started early in the next financial year. And Beach Street realignment is quite a common issue with regards to the stormwater build-up, and Beach Street's options have been reviewed at the moment as well. The Tanker Street has been completed.
Thank you. Beach Street, what do you mean by options being reviewed?
Options in terms of design to recover where the stormwater can hook up to the existing system, or if we have to create a new exit system or put in a sump and pump station.
So what's your timeline on Beach Street?
I don't have one at this current stage until I see what it highly would likely tie in with any development as well down the way. If, for example, Evan Jones started building something within their facility or their property.
I just know it is very bad. Like that whole Beach Street, those sumps don't go anywhere. Water's just sitting.
there is an outlet sump which goes into the rock wall, but that can get blocked up quite regularly.
That's just particularly bad for our town. I think it'd be good to get that sorted. It's almost as bad as the flooding on St Albans Street.
I was waiting for you to say that.
Just remind councillors of what Morrison Street used to be like.
Yeah.
Exactly. Yeah. Yeah.
Solid waste, immediate capping and pilot has been completed. We're in progress of doing fast capping. And obviously the Fox landfill extraction completed. As confidential today, you'll get a report regarding the tender valuation for Butler's landfill construction. Couple of projects, leisure services and facilities. Sunset Point, completed, toilets are operational. Obviously, there's some work underway to do the tidy ups around there. The grass is growing, and it's first mowed a few weeks ago. And obviously, we're finalising the tambo and getting the lighting installed. And we are working with the Heritage Group to bring back the anchor, etc. Carnegie building project, obviously that's started, fantastic, underway. And stage 1 of Lake Canary cycleway, the construction is completed. We're still working through landowner easements at the moment, but that construction started. Question?
The Sunset Point toilets are starting to rust. Have we got a project or a maintenance schedule that ensures that they don't rust away to nothing?
I'll have to look into that.
Thank you.
And I'll skip through this page. Most of this is minor works. Everyone's okay with that. We have started ordered the work, the 3-bay pole shed and workshop for the Akataka Cemetery. Care Square new toilets, we've made an application for TIF funding to supplement this fund, and we have a location identified, but it also sits inside the Care Square development. Waterfront development is a minor works of that fund remaining. We have some more funds to be sought with the TIF funding for the stage 2 approach. And the elderly housing works, that's been work that Destination Western will be completing. Mountain Jade building, we've moved staff out of there this week, and we're waiting for the LTP sign off to start the weatherproofing, etc. And also working alongside Heritage Akataka with the fund that they received for the custom house refurbishments. Council HQ refurbishment and fitting, we've completed the middle floor. If you read down there today, you'll see all the area is occupied. We've relocated staff from the top floor to start the works up here, and also looking to move the finance team downstairs once some refurbishments done down there. Obviously, there's some major work to be done in terms of this building itself, in terms of earthquake strengthening. That scope of work will be approximately about 8 months worth of work. So we are working through a program, and potentially we'll do the building across the road first and then relocate staff through that process. Capital projects, transportation, a lot of works in this space. A lot of significant works as well. You would see there that's the Wilson Creek Bridge from, it's the Dorothy Falls Road, where it got washed out way back in December 19, I think it was, March 19, can't recall which one. So finally getting rebuilt. We have been some major, obviously, challenges with Dixon Bay Road, maintaining the earthworks around there, all the protection works. We've been donated a bridge from NZTA on Wilson Creek will be utilising. Sorry.
Jackson Bay Road and the Kurri River. Was there any thought given to clearing out the channel straight ahead?
That has been attempted and failed. So it is a challenging piece of water. So we tried that, I think, almost 6 months ago to try and straighten the river again, without success. Yeah, it takes a lot of management to keep it going straight ahead.
If it's time, well, I don't know anything about rivers, but it's been done before in other rivers. And if it's time before, when there's a big storm coming.
Yeah, I'll take that as an action to go back and ask again. I think John Braybridge had a crack at trying to do that again. Yeah. Pretty sure we spent a bit of money, wasted money if it didn't go straight ahead. And it's the same as
But if it's going to be, if it's done in settled weather, I mean, it's not going to have any effect. But if it's done just before there's a front coming through, it's
maybe
roll it out.
I need to follow through. There's been, as you know, over the last 12 months, some considerable slips on Jackson Bay Road as well. It's all been cleared. Most of that's, all of that's 100% refundable through the far rate through UTA. Footpath. Obviously, you can see the photo of the airport footpath being completed. We have some funds for Wataroa, the Backstreet footpath to be completed. Ross will have allocated 10K towards that. We've just completed a full asset review of all our footpaths as well, alongside Becca, so that has updated our database, and then we'll be able to put a very clear looking forward plan and works together for that. Chris, Ginny?
The 10K towards the Ross footpaths, is that going to go far? Because
it's 10% of our budget.
I mean, there's quite a lot of the footpaths down there that aren't good enough.
We have to manage that budget so it covers effectively. So we did, obviously, with the evaluation just completed, we can target the high areas first, priority areas first.
Right. Yeah, but have we got a longer term plan in place?
That's what's going to come out of this review. So it's just been completed.
Right.
So a proper maintenance schedule will come from this.
Gosh, yeah, thank you.
Upcoming works, the approaches to Milltown Bridge, they keep getting damaged. Canary pedestrian cycle crossing, obviously that's still to be completed, and obviously getting the exit off the bridge sorted at the same time, and finish completing the road condition rating. This is a couple of big slides, a lot of words in here, but the update from all the hall communities, community hall, sorry, and Warmore's renovation works. They're all at various stages of works. I talked to Sam Blight this morning. There are some issues with material supply, as we can expect. It's not only us, but it's the rest of New Zealand. And we have had to revise some scope of work because of some of the structures' integrity. So they've been rectified as a priority first. I'll skip through all of these, unless there's any specific questions in regards to community halls. The infrastructure reference group funding projects, obviously the solid waste management one, 3.3 million. We're almost at the back end of that, with partners tender being released shortly. Cron Street making good progress. We've seen some photos recently. They're going really well. Old Christchurch Road, there's about 12 weeks worth of work remaining on that. They hope to seal out to Van Beek's Bridge. Have that completed. They were doing that this week. So the remaining sealing will be done in the new spring. Jackson Bay Wharf piling started there. So the rig has been installed. Just to let you know that one of the workers today is in support just come through. There was a shark attack on one of our workers underneath putting the piles in. I managed to get away. No damage done. But yes, it was one of those crazy incidents.
Wow. Thought sharks like warm water.
It's nice and warm
It's like warm water in Jackson, don't it?
Oh, they I know they're great whites, breeding, photo straight.
And there are great whites, because the kids were swimming off the pond too.
This is about 2.5 meters long, this shark.
Oh.
Hey, give you a lot. It'd be a great newspaper article.
You don't give us that. And Hokitika swimming pool, we plan to have the tender documents to council in June. It's taken a while, mainly due to resources to do the technical design work for us to enable the contractors to be able to tender towards those works. So our architects are great enough. I've been under resourced to supply the right materials, the right designs. There will be an announcement regarding the time frame for that work as part of that process. So the concept's completed, the ROI has been advertised, and we have a number of tradies quite keen to work with us in this space. We'll get that tender towards council on 24th of June.
Just to comment, I don't know why, but I seem to be getting all these people say, like pool patrons say they don't know what's happening and Aqua's cancelled and all sorts of weird stuff. So have we got a really good communication line from us through to DW, through to staff, through to pool patrons? Because there seems to be a whole lot of mixed messages going out to, you know, like people that actually use the pool.
Yeah, it's fair to say there's been some staffing resource challenges from DW, knowing that this was coming, that retaining staff has been hard. So I would say that the communication could have been better, but we're probably initiated in the last week to get that stepped up significantly.
So when people ask us when the pool's going to close, the answer is we don't know.
No, we have a fair idea now, so I can't confirm that until Mel has locked that in. So I wouldn't want to say it today without getting it concrete.
Yeah, that's what I mean. We say it is not confirmed.
No, it's almost imminent to be confirmed.
Oh, but what people are saying in the community is not correct. You know what I mean? They're saying, oh, it's going to close here and there and it's closing, and they don't know. They don't know correctly.
DW is about to set the date very shortly. Put a press release out. Some photos of the works. So it's good that we got the additional funding to do the footpaths in Francis Joseph on Street, all the way to the port. And some of the works for Fox Glacier. It's fair to say the contract at all has gone extremely well, hasn't it? And more volume than we actually anticipated. I think we budgeted 40,000 tonnes. Photos there. Just a reminder, councillors, that Jackson Bay Wharf, to do the full Monty and get the full wharf repairs done, it's another $2 million. There's a potential application in that space going forward. But we're focusing on making sure the causeway is fully functional, and the wharf itself is a future project. The Three Waters Reform Stimulus Fund, there's a lot of 43 projects that we've actually allocated from the $6.9 million, ranging in various sizes. As you can see, there's a lot of work in there, but we won't go through each of them. But most of them have all been tendered now through the previous council meeting, so we're in the works process. So good to see things getting built or ordered. Any further questions or worshipful councillors?
Councillor Cohen.
All I actually want to say is this is a brilliant presentation. Like it's very simple but very self-explanatory. Love being able to have really good pictures and easy reading around the whole finance of the projects and where they are currently progressed. So yeah, love the whole concept of how this has been developed.
Just highlight, just to thank the teams that are leading all these projects. It's a huge amount of work in this space, considering also the amount of carryover projects we've got in here. There will be carryover again this year, but we have resourced up. Like I said, when we went through the LTP process, we had a new project manager starting on Monday, full-time resource, which will take a lead on some of the bigger projects. So yeah, we're starting to crack through these projects quite well.
Councillor Davis.
I just, once again, it just highlights the volume of capital projects that are being done and completed. You know, it's really really exciting and a good feel for the community. Good stuff.
Councillor Neal.
Yeah, likewise, thank you very much. Huge diversity. What's that photo of the Jackson's Bay one where they're measuring something?
Oh, that's when they did the first assessment, engineering assessment of the piles. So they're measuring the degradation.
Oh, that's one of the piles. Okay.
And what they found when they did some core drilling, most of them were rotten internally. So that's the piles they're targeting to replace.
So it's pulling off its power.
Yeah, that's what I thought.
Councillor Hartle.
Yeah, no, that's all good, very good. I look forward to the day that the Jackson Bay Wharf is up to strength and we don't have to worry about it. But very good, thank you.
Councillor Hart.
Yeah, thanks, Simon. Good report.
Councillor Martin.
Thank you for the report, Simon. My only other question is around Old Christchurch Road, which we kind of talked a little bit about, but it says that extra earthworks and unexpected items have caused the first two sections to be more costly than anticipated, and we're going to run out of funding for portion 3. So have we got a cost estimate of what portion 3 will actually cost?
Yeah.
If it was to be completed?
If you recall, the original tender was well under the actual funding request. So there's a bit of contingency to utilise in that space. I don't have a final costing on portion 3. There were some major constraints in terms of some of the widening that had to occur. It cost additional costs and additional fencing there to go up as a replacement for that. So I'll have to come back to council in terms of where we'll get to. We're always targeting to do 12 Ks, but we may actually do more than that while we're here.
Is it sealed?
Yeah.
Yeah, so you'll kind of upgrade the whole road and seal at least 12 Ks.
Yeah.
And then the difference, so we will achieve what we set out to achieve.
Correct.
Yeah, we're not going to fall short of what we thought we were planning to do.
That's my current impression. Like, you know, as we develop, it's only 12 weeks ago, so they shouldn't have your idea.
Well, I'm just wondering where it sits with our LTP process too. 12 weeks is going to take us out of the planning cycle. I know, I appreciate that, but if we only can achieve 8K sealed, and you know what I mean.
I'm anticipating that 8K's already been sealed now, so there's only additional 12.
Cool. That sounds great. We're going to achieve it.
Councillor Kennedy, you've just popped back up on the screen there. Any questions on this? No? Thank you. Paul.
Very good, handy report to have. Of course, I'm mindful that whilst we're congratulating ourselves on these wonderful projects, about the cost of this that hangs like a millstone around the necks of all taxpayers, I'm afraid. The government big spend up last year. However, we're benefiting from it, but I'm just cautioning that there's a cost at the end of the day for us, and that's cost us on all of us and future generations.
Nothing for me.
I think the thing that sticks out for me in this report is that, having just read the DWC economic report for Westland, you'll notice that the unemployment in Westland is 2%.
Yeah.
Incredibly low. Yeah, that list of work that you've seen there today, it's only a small part of what's going on, but it's a significant part, it's an important part. So I think from an economic recovery point of view, we're doing our bit, and probably a lot more, is the truth known. So a good report, Simon, thank you so much for that. Would a councillor like to move that? Just go back up here, the capital projects update from the Chief Executive, Western District Council, we received. So maybe Mayor Carruthers and Councillor Davidson, thank you. Those in favour?
Aye.
You just correct me if I'm wrong. I think we're about to move into public excluded. Yes. To those of you that are watching, ratepayers and residents, thank you for being part of today's proceedings. And if you have any questions, send us a message. Now, I'd like to move that council move into public excluded, please. Councillor Davidson, Councillor Neal, those in favour?
Aye.